And Heart-Led Psychotherapy helps people to start live a life through their heart and soul rather than through their ego. So helping them to be more free of pain and suffering. It can be used either as a standalone therapy or as part of other psychotherapies. So this is where EMDR comes involved, is that you can combine the two to help treat psychological distress.
Alexandra Dent, welcome to the Art and Science of EMDR, and thank you for joining us.
Thank you very much. Welcome, everybody, and also welcome to those that might be watching this on the recording as well. This is really an overview of the area of using spirituality in the work we do. And if you're interested in looking and exploring that even further, then I'm participating in the book club in a couple of months' time, where we can delve into some of those areas in a bit more depth. What I'd like to do is to start with a very simple heart meditation. So let's think about just connecting in our hearts. And this is something that I do with clients now and sometimes supervisees right at the beginning of the session. It's something I've introduced in the last few months, and I found it really valuable. And it's just to start off the session in perhaps connecting into the energy of our hearts. And this is something you can take away with you and start using if you enjoy it. But thinking about the aim of this webinar and setting our intentions, what I'm just going to invite you to do, if it feels comfortable, close your eyes. If you prefer them open, just look at a neutral gazing spot in front of you. And just become aware of how your body is sitting. If you're sitting on a chair or if you're standing up, just become aware of how your body is, the contact points of your feet on the floor. And I'd invite you just to bring your awareness to the movement of the breath into and out of your body. Don't try and speed it up or slow it down. Just allow it to be whatever it needs to be in this moment. Letting go of any of those racing thoughts or things that you might have been doing just before you connected into the webinar. Just allow that to move on by, and just really bringing your awareness to the movement of the breath into and out of your body, allowing it to ground you in the here and the now. And then if it feels comfortable to do so, I'd like you to bring your awareness to your heart area. That is the area within you that represents your unconditional love, not only for others, but also for yourself, compassion, your inner truth and your authenticity. And just connecting into that area, invite the breath into and out of your heart area, allowing it to settle into a gentle, harmonious rhythm. And then if you'd like to deepen the experience even more, then you may want to connect with some beautiful high vibration emotions such as joy, love, bliss, grace, peace, and just drop them into your heart area with the breath. And you might like to imagine your heart pumping those emotions around your body, reaching every single cell in your body and energy field. And then just allowing this process to continue throughout the webinar and beyond. Just notice the contact points of your body on the surface that you might be sitting on or standing on. Wiggle your fingers and wiggle your toes. And if you've had your eyes closed, just gently opening them up and coming back into the webinar with me now. Okay, so just looking at some of the ground rules, which I'm sure will all be familiar with you, but we just want to create in this webinar with us a safe environment. If things are shared between us, just some sense of confidentiality with that, and to take a compassionate, non-judgmental approach. So if there are things that you want to share or ask questions about, just really trying to come from your heart area and respecting other people's beliefs and viewpoints. I think the area of spirituality is a very triggering one for quite a lot of people. So we really want to be as open as we can be and operating with honesty and authenticity. And something that I'm quite interested in with my work and the idea of spirituality is how we can all be mirrors for each other, which does mean that we will trigger each other at times. But I always see that triggers are an opportunity for helping us to realize what is still going on within us that we need to work on within ourselves. So it provides an opportunity for healing. So if there are things that you are triggered about, either somebody might say something or I might say something, please just try to explore and be curious about what that might be about for you. So the aims, quite big aims, we'll see how far we get, is to provide an overview of the biopsychosocial spiritual approach. And I'm going to briefly discuss heart-led psychotherapy, but I might explore that further in the book club. Practical ways to look at spirituality with your clients, including working energetically, and then how we can introduce this into our EMDR therapy. So just to say that this webinar isn't really focusing on different religions or spiritual practices, it's an overview of how we can work with anyone regardless of their spiritual belief systems. And it's really focusing on taking a heart-led and authentic approach, not only for ourselves, but also within our work. So a couple of things that I'm really passionate about is I might say some things. You need to, I'd encourage you to really tune in your heart and just say, does this resonate with you or not? What I say is ideas that have been formed from my own journey, but I'm not saying it is the truth. And I think our truth can change as we progress on our spiritual journey as well, as we connect more with different areas in our lives. So these are ideas, find what works for you. And if you can, try to be as open as possible, because we will only ever progress as far as our belief system will allow us. So if we do have some limiting beliefs, it means that we'll get stuck there. So just explore that and see whether we're open to changing those and seeing whether there are other options. I'm also a big advocate that I think everyone, as I said, in our life is our mirror, and that includes our clients as well. We're all here, each other's mirrors. So important that we're open to looking at exploring that within our own work and our own journey. There are lots of different, perhaps, interpretations of spirituality. This is the one that I use, and I like this one. I'll explain why in a minute. But just to summarize, spirituality refers to an individual or a group's relationship with the transcendent, however that may be construed. It's about the search for transcendent meaning. Most people express their spirituality in religious practice, whilst others might express it exclusively in their relationship with nature, music, the arts, or a set of philosophical beliefs or relationship with friends and family. And the reason why I really like this definition is because it is so inclusive of lots of different areas. So we might find a very spiritual connection with nature. For me, that's incredibly important. Or it might be through art or music or being in a certain place or connecting with different people. Spirituality to me is also about having a connection with a higher presence. So for me, that's a connection with what I call or refer to as a divine source. And I see the divine source as a source of unconditional love. So it's an openness and acceptance that there's something more than just a physical, cognitive, emotional being. And when we connect with that divine source, we're able to channel and pass that love not only within ourselves, but to those around us. But again, that's something that's quite personal to me. I think some people might really connect with that, and other people might find some of those words difficult. They might prefer to use God instead of divine, or something else that really connects with their own belief system. And spirituality doesn't have to mean that someone believes in a soul. So I think that's something that's always very important to explore with clients. But in Heart-Led Psychotherapy, where I have the working model, the soul represents a spiritual or immaterial part of a human being or animal, regarded as immortal. So that's one definition. And the soul, mind, spirit, or invisible animating entity which occupies the physical body. I believe that we have an essence within us that is connected to the divine source and that carries our memories and experiences through different incarnations. But again, find out what works for you. I have some clients that don't believe in a soul and some that might have their own understanding about it. So I'm always working with what's true to them. I don't know whether you're aware of Irene Siegel. She's an amazing American lady who works in this area as well. So she's a lovely colleague, and she's written quite a lot about how to use spirituality in EMDR therapy as well. And she came up with this term spiritual resonance. So she described this as vibrational patterns of greater cosmic wholeness experienced through soul awareness. It's inclusive of all forms of resonance, not component-based, and transmitted multidirectionally in the energy field between therapist, client, divine source, and earth. So here she's saying that there's something more than just going on between you and your client, that there's a connection beyond that, which she will, from a universal perspective, and this can allow multidimensional healing. So she explains that during the process of resonance, it's suggested that one moves beyond the egoic mind to access a higher presence, cosmic energy or divine force, which can be very transformative and healing when working with clients. So if we give a quick overview of the development of how it came about, the biopsychosocial model, I'll just quickly touch on this. So Engel, I'm sure all of you are aware of, in the 70s proposed a biopsychosocial model. And I remember when I was doing my training to become a clinical psychologist, that was the key thing, the key words, that using a biopsychosocial model. So looking at the impact of what's happening biologically, psychologically, and also the social environment that people are in, taking all of those perspectives when we're formulating. It was then Smolsey in 2002 where I explained the definition before of spirituality. He proposed a philosophical anthropology to a biopsychosocial spiritual model for end-of-life patients. And since then, there's been quite a lot of research into this area, using it with different client groups. So Hacker Hughes, who is actually an EMDR consultant in the UK, suggested the use of using that approach for psychological conditions. And then Reed, who's a psychiatrist in the UK, has discussed using a biopsychosocial archetypal approach. So it gets very there are lots of overlaps between them, but he came up with this terminology. And he talks about it being another more subtle layer with an archetypal influence being mediated through our environment, our psyche, and our sensory apparatus in varying degrees. So he's quite informed by the Jungian models and ideas. So here, and hopefully these PowerPoint slides will be made available too. So if anyone's asking about that, don't panic too much. This is just me providing a very brief overview of how we can look at bringing working in a spiritual way. So when we do an initial assessment, we can either do the traditional biopsychosocial model, or we can bring in the spiritual approach. What I was curious about when I was exploring Heart-Led Psychotherapy is, whilst people were saying spirituality is really important to introduce in our work, I couldn't see a working model to help guide people, and that's why I then came up with Heart-Led Psychotherapy. So I put that there. And it has, which I'll explain in a bit, it's got a heart-led model or a heart and soul-led model, depending on what works for our clients. So I'm going to just give you a very quick overview of this. It might be that if we have time at the end, I can go into it in a little bit more detail. I'm just conscious of making sure that I get through as much as possible. But Heart-Led Psychotherapy is really about helping people to connect more in their hearts and live a heart-led life and an authentic life. So it's a way of understanding challenges and traumas that underlie psychological distress from a spiritual perspective. It's a spiritually informed model. So when I did a lot of healing on myself, I did a lot of Akashic record clearing, which is a soul level clearing. And I did some Akashic record training as well. And so this model is quite informed by those ideas and beliefs. And Heart-Led Psychotherapy helps people to start live a life through their heart and soul rather than through their ego. So helping them to be more free of pain and suffering. It can be used either as a standalone therapy or as part of other psychotherapies. So this is where EMDR comes involved, is that you can combine the two to help treat psychological distress. So it's got two working models. You've got the heart-led model. Now, the heart-led model can be used with anyone regardless of their spiritual beliefs. You don't even have to mention the word spiritual or transpersonal. And then for those that are open to working more at a soul level or who believe in reincarnation, areas like that, there's a working model called the heart and soul-led model that helps to take into account perhaps some soul blocks and restrictions, and also things that they might have brought in from past lives. So if we're looking at the heart, I think I've got some definitions further down as well. But when I talk about the heart, and when we did our meditation at the beginning, and I invited you to connect into your heart, we were looking at that representing your seat of inner truth, your compassion, your love, not only for yourself, but for others. And it's also the seat of your authenticity. Now, there are some in the spiritual community, there are different ideas and phrases that can be used as well. So I've just put, some people talk about having a heart chakra or a second chamber of the heart or sacred heart, just to make you aware of that. But I try to just keep it simplistic and just say, just connecting with your heart area. So in Heart-Led Psychotherapy, ego is really important as a comparison to the heart. And when we talk about ego, the definitions I've used here, just to help kind of clarify that. Here it's the part of the mind that mediates between the conscious and the unconscious, and it's responsible for reality testing and a sense of personal identity. So Chopra, one of his definitions is, it's not who you really are. The ego is your self-image, your social mask. It's the role you are playing. Your social mask thrives on approval. It wants control, and it's sustained by power because it lives in fear. Another definition is the conscious thinking subject. So in HLP, the ego represents a person's self-image, their overthinking, their overanalysis that's causing them suffering and distress and keeping them stuck in repeated patterns. And a phrase that I found, I can't remember where I found it. It's not something I came up with, but ego, someone said, it's eliminating goodness, or sometimes you could say God out. I'm not anti-ego, by the way. I think ego has a good function in our lives. It's the relationship we have with the ego and our awareness of the impact it's having on our lives. But I think in spirituality, some people believe, which really resonates with me, is we're not trying to get rid of the ego. We become aware of it, perhaps the stories it's creating in our lives. And then when we're aware of that, we have a choice of whether we listen to it and we follow those choices, or whether we choose a different option. So this is where I might very quickly just give an overview, because it's another area I want to focus on. So bear with me. So the idea about HLP is that we're on an individual journey. And that's really key, because that then helps explain about why rescuing doesn't work. And if I remember, I'll touch on that in a little bit. So doesn't it look lovely? You know, we're on this amazing journey and it's just all going smoothly. I don't know about your experiences, but my journey has most of the time looked a bit like this. Absolutely, things thrown at you from different areas and things to work out, lots of triggers, lots of mirrors, etc. Lots of clearing and healing that can be done. So I've mentioned before about the HRP being spiritually informed, and one of the key things is about the idea of here to understand life lessons and experience life lessons. So we're on an individual journey to experience and understand these life lessons, and they're an opportunity to honor our authentic selves. And there's a multitude of different life lessons that we could have. It could be about power, love, humility, joy. It could be about happiness, partnership, faith, etc. And life lessons are an opportunity to teach, heal, and learn either within ourselves or with others. They're not about being punished. It's not about we must grow or learn in a certain way because we're lacking. The experience that we get through the life lesson enhances our ability to understand situations and ourselves more fully, and helps us to make more heart-led choices rather than ego-led choices, to help us live a more authentic life. So we've talked about the examples there. And the idea is that we experience life lessons in their entirety. So they're positive and perhaps the negative aspects of it. For example, if I look at the idea of the life lesson of power, if someone has that as their main life lesson, it might be learning when to have power and when not to have power, when to allow others to have power and when not, to experience power from others and when not to. So it can be seen in many different aspects. And what tends to happen is that we might be experiencing it in one area, but not having fully experienced it in all of those different areas. And life lessons can affect different areas of our lives, and we're all very different. So two people who have a life lesson of power might experience it in very different ways. So someone might experience it in the area of their work, primary relationships with family and friends, finance, health and well-being, spiritual development, environmental community. Someone might have all of those areas or might be just focused mainly on one of those areas. And then we have 4 main life lessons. So we have our primary life lessons, the main theme that we're working on in our lifetime. And sometimes people have a few secondary, but generally we have our main primary life lesson. And when I'm doing an assessment with a client, I'm always looking at the themes that keep running up. What's the area that they're really struggling in? Is it assertiveness? Is it compassion? Is it forgiveness? And their experience that they had are those opportunities to try and experience that. And is that something that they're getting stuck in? Another area is joint lessons, where they might be experiencing a theme with another person. Someone might be more a teacher, the other person might be more a healer, or they're both there to learn from each other. We can also have, just to help us on our journey and just to give us a full expansion of things, we can have things that happen which are called everyday life lessons, which is where we go through various areas of our life where there might be a consistent theme that's being played out. For example, boundaries that might be happening in different areas just for a period of time. And then systemic life lessons are things that happen within our environment, our community, but also the world. So the pandemic is a good example of a systemic life lesson, where people are given an opportunity to see how they work with the environment around them. So I'm going to skip the next few because this is something that we can explore more in the book club, but that's just an idea of how these are some of the areas that I'm using when I'm working with my clients, and I go through the Heart-Led model, which is here. So you should get this on your slides, but it just talks about how challenges and traumas and attachment difficulties, which we see within all our clients and we probably experienced ourselves, we know creates those blocks and restrictions, and that can lead to these repeated patterns that we keep going through over and over again. The ego that can come along as that kind of that part of us that creates all those stories, those horror movies, can keep us quite stuck in that loop, or making same choices because we're scared of change. And then the model helps us to look at how we can break out of that by becoming an observer, understanding what life lesson we might be experiencing, and to try to make a more heart-led choice that can lead to a different outcome. That's where we attain the gifts of understanding the life lesson, but we also start learning to have more self-love and authenticity. So I'm just going to, because you've got these on your handout, but this is an area which I'm really passionate about, and I'd like to just kind of go in a little bit more detail, is working energetically. So some people don't like the word spirituality, or our clients might struggle with it. We can still do some of this work, but thinking about energy between us, between them, and helping them understand themselves as electromagnetic beings. There's this amazing book, I'm sure many of you are aware, but if not, I'd really recommend it, by Joe Dispenza, about becoming supernatural. And what I love about this, he's a medical doctor, American medical doctor. He has so much science and research in this book about the evidence of the benefits of when we connect in our heart. And he does a lot of work with heart math and heart coherence, which is the little exercise I did at the beginning, just helping us to get more in heart coherence as we connected, and the benefits of that. So if anything we're doing, if we can do that with our clients, we're making a difference. Now, some people believe that the heart is the seat of the soul. And so even if we're not using the word spirituality, we are at some level connecting in this way, but we're just using different language. So Joe Dispenza talks about experiences not only enhance the brain circuitry, but they create emotions. So he talks about emotions as the chemical consequence of past experiences, and emotions are energy in motion. And the thinking feeling cycle creates, so we have an electromagnetic field around our bodies where we're always receiving and sending out energy. So you think about when you're with your client, how you are, how you prepared for your clients, the energy they're coming into the session, how that's interacting with each other. Now, this is a lovely slide that I show quite a lot of my clients. I'll get the book out and I'll explain this to them. And the reason is because if you can see, hopefully you can see on the right-hand side, it's got a list of different emotions, which I'm sure are all very common, very familiar to us. And it shows the frequency that they vibrate at. So if we look at some of the areas where our clients might come, they might be angry, they feel shame, they feel pain or grief. These are the emotions that are vibrating very slowly, very sluggishly, okay, down here. And then anger is slightly higher up. But as we move up here, and we're coming into emotions such as gratitude, appreciation, got joy, love, freedom, and bliss. Can you see right at the top, bliss is vibrating so small and fast. It's a completely different from the lust down here. So this is showing that if we are able to learn to connect with more positive emotions, even if we don't feel them in that moment, if we can start trying to connect with them, whether it's through affirmations, whether it's through connecting with nature, or just doing other areas, lots of self-care in our life, and bring those emotions into our body, we are literally changing the vibration with which our cells are moving at. And if we're able to do that, then the energy that we're putting out there, we're putting out the joy, the bliss, the love, we're more likely to then bring that, invite that into our lives. So it really works with kind of this idea of affirmations and intentions and creating our own future, is that we have the ability to really have some say in how our body is at, what we're wanting to move towards. And this is how lovely ideas that we can bring just as part of self-care through our days, thinking about where our energy is at, what do we need to change if we're feeling tired and sluggish, how can we change that? And if we connect in our heart area, and do some heart coherence and invite those positive emotions, we are literally changing the energy field around us. And the epigenetics, which I'm sure a lot of you know about, that changes the DNA expression. So that helps heal ourselves. And then as we're electromagnetic beings, that radiates and that will impact on the people and the environment around us. And that's where changes can happen. It might be that things that no longer resonate need to fall away from someone's life. And then that leaves space to invite new opportunities, new relationships and experiences that are resonating more with where their vibration is at to come in. And that's where change can happen as well. So I hope some of that's familiar with you. If not, it's an area I'd really invite you to explore. And I think when you're with clients is thinking about, before you connect with them, where's my energy at? If I'm feeling tired and sluggish, how's that going to impact the connection that I've got with my client? If I'm able to put myself into a more joyous, loving, compassionate place, then that's also going to be felt by the client. When I'm doing EMDR processing with someone, I'm there with them, supporting them, but I'm constantly thinking about how I can use my breath to really regulate my energy field so that they will benefit from that spiritual resonance that Irene Siegel was talking about as part of the process. So there's energetic shift going on as well as them doing their EMDR healing. So that will help them to heal at a more multidimensional level. So these are some of the slides again with Joe Dispenza that I will show. Quantum field, I'm not going to go into too much detail because I want to come on to how we can bring in areas of spirituality in the EMDR. But he's also very passionate about connecting with the quantum field, which he talks about as an invisible information and energy where all possibilities exist. So the more we're able to look at the energy we have within us, then we can connect with all those future possibilities and make them our reality. And this is something I love, is that, again, I think this is quite well known, is only 5% of us is unconscious, 95% of us is subconscious. We can move, and this is quite a spiritual idea, we move from being somebody, which is quite an egoic way of thinking, to nobody, to everybody. So that's a quite transcendent way of looking at how we are and interacting in life. Okay, I'm conscious of time, so bear with me. You do have the slides. Here I'm just going to come into some of the EMDR areas. Okay, so transpersonal EMDR. There have been quite a few people who've looked at how we can bring transpersonal areas into the EMDR. Parnell's one of them. Siegel, as I said, Irene Siegel has also written quite a bit about it and looked at meditation and connecting with wise figures, nurturing figures, etc., how we can bring in spiritual resources into areas of our work. So Art O'Malley, who's in Ireland, he's written about sensory-focused EMDR. But more recently, last year, he's introduced this idea of quantum EMDR. So these are, again, areas that are really opening within our field. And I've got references at the end of the PowerPoint if you wanted to go and look at those in a bit more depth. So Parnell talked about enabling her clients to go beyond their egos to connect with transcendent or cosmic experiences. And I've talked about Siegel. She's talked a lot about connecting at a heart level with her clients. She uses shamanic work within her EMDR therapy to help with that energetic connection as well. And then there's Walid Abdulhamid, who wrote about the similarities between EMDR and Sufism, and yeah, comparing those two, which was interesting. There are a few protocols out there, so you might like to go and explore those. For me, I personally believe the standard EMDR protocol is the main protocol I use, and then I might bring spiritual aspects to it. But I think the standard protocol is very, very good for working with most of our clients, and I try not to deviate too much from that. So when if I've taught someone Heart-Led Psychotherapy, I can bring in certain types of interweaves. I can bring the ideas into the preparation stage, part of our processing, and then it can help people to manage future challenges. And again, if you're interested in exploring a little bit more about that, we can go through it in the book club. If I haven't gone through Heart-Led Psychotherapy with people, so the idea of life lessons, etc., then I still think we can use this idea of connecting in the heart and how we can introduce that in different areas within the different stages of the EMDR protocol. So I'm going to quickly give an overview of that. That's a beautiful place down in Glastonbury. It's really lovely if you ever get to go. So before I connect, so thinking about energies as well, before I connect with my clients, whether it's online or whether they're coming, I will say a prayer that's helping me to connect with, for me, it's the divine source. For you, it might be something else that resonates. And I will be asking that any energy that comes from the clients is transmuted into divine love and not attaching to me. So I'm trying to put some protection around my energy field, because I think that's really important, where a lot of people who are interested in spirituality are quite sensitive souls. So they might feel, they might pick, they might absorb clients' energies. That might be helping the client, but it's not going to help you as a therapist. So it's really important that you're thinking about how you take care of yourself within sessions. Thinking about the clinic space. So in my clinic room, I'm very fortunate. I have my own space that got a little video there. There it is, just within here. This is just a quick. Oh, it's doing there. It's doing it in a bit. So I've got crystal bowls. I've got various oracle cards. I've got crystals. I've got Himalayan lamps. I smudge the environment regularly just to kind of cleanse the space. It's fairly obvious if someone comes into my clinic room that there's some crystals just down there, that I work in a spiritual way, whether someone wants to work in that or not. It's the environment I'm in. But most people, well, everyone will say that the environment is very calm and relaxing. That's really important. And energetically, it feels safe. And so thinking about your clinic space, if you can, there are things you can change. You can use protection spells. I've got a guardian sacred spray here that I might use. If you don't have the luxury, so you might be going, oh my God, I just don't have luxury. I have this really dire room and I share it with other people. Don't forget that about alchemy, okay? Who you are, how you are, the energy you bring into a room in this space is enough. These things help, but if you can really work on the energy that you are trying to resonate at, and if you're connecting in your heart and you're asking for protection from whoever it is, that will change the energy in the room itself. And that, just please don't forget the importance of that. That is the most important thing that you can do. If I used to share rooms with other people, and I used to just take in some crystals and a spray, and so guardian spray and a lamp, etc., just to set the scene a little bit more. But even if I didn't have that, if I'm connecting, if I'm just asking for that room to be cleared energetically from people who've been in it before, that is just as important. So history taking, we can look at getting an idea of our clients, of what spiritually resonates to them. We can, we can look for openings. They might say they do something like yoga, they might meditate, they might use psychedelics. So if there are a little bit of openings there, then we can explore those further with them. But don't be afraid to just ask what their spiritual views might be. So I can come on to that in the book club. But Asking about spirituality is quite nice to do at the beginning, but even if you don't, there might be opportunities throughout the process of EMDR where there's an opening and you can start to explore that more. So these are just some ideas of questions. And again, we're going to explore that more in the book club. I always laugh when I say this because I don't know what I say. If I say, I hope you don't mind me asking, but what are your spiritual views or what's your spiritual take on that? It's like there's some kind of, I'm needing permission because it's an area that perhaps isn't talked about so much, rather than just saying, would it be possible that you could share it? But I'm asking permission still, so that I'm just curious about that. But you could say, what does spirituality mean to you? And if your conversation evolves even more, you could explore about soul and what happens to the soul, what their beliefs are after you die. There are some questionnaires you can use that can explore the mindfulness and spiritual wakefulness. So the references are at the end as well. In preparation, we could look at either teaching people about heart coherence, or for me, I'll talk about Heart-Led Psychotherapy. You can help them to do heart meditations or lots of self-care ideas. In part work, I mean, I love part work, and I think that can be really valuable. If you are doing part work, bringing in this idea of connecting in their hearts when they're going to communicate with different parts can be really helpful, just to add a slightly deeper dimension to this. Resourcing, lots of resource development installations, so connecting with spiritual beings, wise beings, etc. It might be that they have a sacred place that they want to connect to as part of their peaceful place. They might use power animals, nature, etc., ascendant masters. That for me is cover of the book. But that's, I went earlier and gave my tree a hug just because I was coming here. That's part of my daily practice as I go and be present with that tree, which is very special to me. So part work, I touched a bit on that, but you can also do, if you're doing part work and you're connecting with an inner child or a part, you can form a heart connection between your, that wise part of you and the inner child or that part, and just allow that to happen. So it's just introducing these ideas. The assessment, as I said, I really resonate with the standard protocol. There are ideas that you could do about rebirthing and float back to past lives, but we'll explore that more at the book club. Please only do float back to past lives if you have a good knowledge, understanding about that, about what that is. You've had your own experience. I wouldn't recommend people do this if they don't have that knowledge or awareness, because you don't want someone to connect there and not then know how to manage that. Sometimes people connect with past lives spontaneously, and if you just in processing, just allow it, because it's probably they're going to connect and then come back out of it. They might just need to dip in. So again, just be in your heart and trust the process. So desensitization, we can look at helping to connect with intergenerational trauma and clearing it from someone's heart, just sending love down that channel, down the ancestors. Irene talks about shamanic healing. I use some light language. You can bring in other ideas. You can bring in some ideas of Reiki energy, crystal bowls, sound. I know people use sound and music as well. These are just some ideas of spiritual interweaves. So I might bring ideas from HLPs, so helping them to connect in their heart and soul and say, what's the message from your heart and soul? Or what do you think this might be helping you to understand from a life lesson point of view? Or what could this person be here to help you understand or learn? Or what might you be here to teach them? But I'd only ever do this if I've gone through the model with them. So if you haven't, then just don't forget, you can get them to connect. If you feel they're very in their egoic way of thinking, you could just invite them just for this next set. I'm just going to invite you just to connect into your heart and just notice, and then just do a set of BLS with that.
Thanks, Alexandra, and I'll see you all in the community and in the book club for those of us who want to join us. Thanks, y'all.
Thank you. Bye.
Bye.